AISNE would like to welcome you to today's session. I'm Becky Biggs, Director of Professional Development. On behalf of our AISNE team, I'd like to thank you so much for joining us today. Today's session will focus on COVID-19 HR essentials for independent schools. Human resources can be challenging under normal circumstances. COVID-19 has introduced new complexities for managing faculty and staff in K-12 schools. In this webinar, experts in public health will discuss the current COVID-19 guidance related to HR and how to manage a safe environment for employees that does not create undue hardships for your school. During this session, we will cover how to manage changes for employees providing both traditional classes and remote learning, navigating COVID-19 remote work policies that avoid undue hardships on your school, documenting workplace safety measures taken to reduce the risk of COVID-19 on campus, and other topics that will come up as the session goes along. I'm joined today by two members of the Fusion Cell team, Scott McKenzie, Senior Strategic Advisor, and Mike Klingshirn, Director of Consulting Services. Fusion Cell offers COVID-19 readiness assessments and policy implementations provided by the nation's top veteran public health experts, military specialists with credentials that include occupational and environmental health certifications, expertise in OSHA and HHS compliance, health protection policy, infectious disease control, and pandemic operations. In addition, they bring extensive knowledge in managing human resources. At this point, I'd like to hand it over to you, Scott and Mike, and thank you both so much for joining us today.
Thank you, Becky, and thank you to everybody at AISNE to let us be a part of the leadership retreat. And we really hope that this presentation is value added to everybody that's dealing with issues surrounding COVID. So a little bit about Fusion Cell, just the background. Fusion Cell was a staffing company prior to the COVID kickoff of 2020. Their focus was bringing military veterans into the civilian workforce, using the recruiting strategies that the Air Force has bred into some of their folks to make sure that we could help people navigate into the jobs that they've been trained and have experience in, and how to translate that experience into job descriptions. A lot of the stuff that you see on the screen is where we had our big focus on. And then, as Matt Morrissey, the COO of Fusion Cell, would say, St. Patrick's Day hit. And that was a bad day for New England because Tom Brady left, the Dunkin' Donuts closed, and all the parents were told their kids weren't going back to school. So they did a pivot. They looked into what the skill set was specific in the military that we had that could help businesses and organizations plan for pandemic operations, and the resounding piece to that was emergency management and public health. And so from there, they reached out, they talked to me first, which was my, I guess, race here. I was the first person they brought on, and I brought with it my military experience, my public health experience, my experience in disease containment planning and risk mitigation. And that's across all diseases, not specific to COVID, but things that we've been doing in the military for decades and decades, as Scott will tell you. So we brought all this experience in. We just needed people to work with us, and we jumped in as, Scott, if you can switch slides. As you talked about, we have experience, we have expertise, and we bring these solutions. But we have jumped in. We've been dealing with independent schools throughout New England. We've been dealing with businesses. We've been dealing with airports. We've done some hotels and hospitality areas. So it's been a very busy 6, 7, 8 months now. And we're happy to be where we are, and we're happy to be a part of this. So a little bit about me, slide, Scott, and then one more slide. A little bit about me. I bring that board certification in public health. I've been an epidemiologist for the last 10 years. I've had the majority of my experience be with the Air Force. I've done everything from hospital infection control to being a public health emergency officer, maintaining disease containment plans. And then as I transitioned out, moved into the independent school world and into businesses to help them plan and mitigate so that they can resume operations as quickly and safely as possible.
Great. My name's Scott McKenzie. I'm going to be covering the HR portions of today's presentation. My background is 40 plus years as a national international consultant, primarily through the military. I spent 32 years on active duty with the Navy, serving with all armed forces, but primarily serving overseas in consultative manner to foreign countries, foreign governments, as well as US government overseas installations. My master's degree is in public administration. I've got an additional 18 hours of graduate learning in human resource management, and I'm board certified in both public health and occupational safety. So our agenda today is primarily focused on human resource management with the independent schools. We're going to talk about the COVID-19 impact in the workplace, workplace safety, communications. One of the most important things that everybody needs to start looking at is job description updates and remote work policies. We're going to talk about the Americans with Disabilities Act and reasonable accommodation versus undue hardships, so you can understand what you can and cannot do. And then we'll talk a little bit about the leave and personal time off practices, including the Families First Corona Response Act and the Family Medical and Leave Act that has been extended. And then we'll close up with some questions and answers. So what happened? And COVID-19 hits the US. The answer for most independent schools was Kathy, who's either the assistant head of school or the CFO, is now, as of March 2020, the new COVID task force lead. That's the opportunity that we have to do what we need to do. We get our experts together. And why do we do this? Because we need to protect our employees. And the US EEOC, the Equal Employment Opportunity Commission, has a serious number of increased employee complaints and lawsuits because of all the business changes, all the increased risks and all the other things going on, as well as OSHA complaints.
So the impact to the workforce was pretty significant. As March hit, everything shut down, and that was the easy answer. Let's send everybody home. Let's go remote. And you saw some emergency work order or emergency orders that came out of that. But as the days, the weeks, the months progressed, it started to be a return to work situation. So you had more remote workers, and companies have seen productivity erosion, fatigue around the remote environment, functions that did not fit within the remote environment, things that you can't do remotely, infrastructure vulnerabilities, and that's cybersecurity stuff. But then there were faculty, staff, there were a lot of fears about coming back. And so all of the interventions that have been done up to this point have brought us to a new normal. And that new normal is really centered around the very middle of this slide, what the medical journal and what the medical literature tells us about COVID. And it's data that evolves daily. And so you may see recommendations anywhere on the health side from your local health department, the state health department, the CDC. You also have different organizations that will weigh in. And those could be the Department of Labor, Equal Opportunity, Employment Center. You have the Occupational and Safety Health Administration, so OSHA, and even at the international level, the World Health Organization.
So there's some important definitions we wanted to make sure we cover because the media and the scientific community tend to overlap a lot of these definitions. Here recently in the last few weeks, the close contact definition was actually updated as well by CDC. As we learn more about the disease, the definitions are being modified. So a close contact is someone who was within 6 feet of an infected person for a cumulative added total of 15 minutes or more over a 24-hour period. And it starts 2 days before the illness onset. That's when they're most infectious beginning. And then for people without symptoms, it's 2 days prior to the test collection that showed that they were positive. This changed from 15 minutes or more to an cumulative period. So you can have 3 5-minute periods within a 24-hour period, and they found that it's still significant enough to expose you and have you potentially catch the disease. Isolation is another term that's misused a lot. So we try and tie it to medical isolation for the wording here. And if you remember, I for isolation and ill both have I's. People that are isolated are ill or sick, so they have to be excluded. Medical quarantine is when you have a person who has a known exposure and they're excluded for 14 days. Generally, you can't test out of that because people tend to get the disease after 7 days. Between 7 and 10 days, it's still very highly likely that you'll have symptoms. So they don't let you test out of that. But we've got a new term that has come up called travel quarantine. Travel quarantine is based on an administrative order from a federal, state, or local government. A person with potential exposure from travel in a high transmission area. So this is something that we don't know you were exposed, but you had a higher potential. So there's a possibility to test out of that depending on the policy. So as an example, in Massachusetts, in the Commonwealth, they allow you to test out with a negative test 72 hours within your travel period. So employee risks associated with these are things that we need to consider as human resource managers and administrators over the program. The risk for hospitalization or comorbidity, additional problems arising from the COVID virus go a lot higher based on your medical conditions. So if you have asthma, hypertension, obesity, diabetes, kidney disease, severe obesity, or if you have 2 or more conditions, then your likelihood of having severe or complications related to the disease of COVID increases. And data has shown that racial and ethnic minority groups are even more at risk for this based on their health disparities. And health disparities include race, ethnicity, socioeconomic status, the occupational risks of the types of jobs individuals have, and access to healthcare is limited in these groups. And so all of these factors combine to tell us that we need to worry about the risks that we mitigate and what we do to prevent these risks at the workplace. So COVID-19 in the workplace, we really have to update our HR policies for COVID-19. We tend to put the HR policies on the back burner. A lot of our schools do not even have full-time HR staff. They may have contract staff, they may have assistants, but a lot of times the business manager or some other individual is tasked with supervising the HR policies and updates. And so if you didn't think your processes were behind before, you really need to think again now, because HR's rock the world and we need all kinds of changes. And it's important to have those changes. That's what this presentation today is about. COVID requires a detailed human resources update. We have preparation, execution, and response phases that we've assessed here. In the preparation phase, we have a hazard assessment of workplace safety, communication plans, developing job description updates, upgrading your facilities, using non-traditional spaces, employee training and documentation. Then you have to execute those things that you're doing. And that includes all the mitigation strategies that you have. So the cleaning and disinfecting plans, the health screenings, the physical distancing, masks, hand hygiene. Remote work policies are very important, as well as travel policies, allowing the employees to know whether or not they can travel in areas for business purposes and encouraging them to not travel into high risk areas during off time, and COVID testing policies as well. Then you have to be able to respond to the incidents that happen. Sick employees and student protocols. Both students and employees relate to human resources, because the students become a risk factor for the employees. You have to coordinate with your local board of health and do contact tracing when you have a positive case. And then we talked about medical isolation and quarantine. those measures have to be taken for people who are ill or people who have been close contacts. Increased communication is so important. It has to be done. We have to talk about what's going on and letting people know so that they have a reduced amount of anxiety. And then there are required reporting processes that have to be done. So the first thing that OSHA requires is and OSHA is usually covered under the human resources section as well as other factors that get given to human resources. So the first thing you have to do is do a hazard assessment, and you grade basically from high risk to low risk. If you considered your school, the highest risk people would be your nursing staff, your medical staff, because they're going to be around people that are actually symptomatic. They're going to be evaluating those people that are sick. Then you're going to have your maintenance people that would be a high risk. Those individuals are working with cleaning up after a room has been used by somebody who was identified positive, or working with the sewage systems or other high risk areas that have the potential for transmission. Then your medium risk would be your standard faculty and population for the staff at the school. The next thing you have to do is determine who needs personal protective equipment. There's a difference between personal protective equipment and masks. Masks are recommended for everyone, and masks are not respirators. The people that are in the highest two categories, the medical people and the maintenance people, may have to have actual respirators, and they need to be fit tested for those respirators and have a respirator protection program for those individuals. The masks themselves are just an added factor to help protect people, but they're not considered a personal protective equipment because the occupational risk is different. We also have the hazard communication standard. Everybody is now being exposed to additional chemicals, and the hazard communication standard talks about your safety data sheets. They used to be called MSDSs, material safety data sheets. Every employee has the right to know now and understand what kind of chemicals they have that they're being exposed to. Most of the situations now require the teachers and other faculty members to be using things that have potential hazards. So your chemical wipes and those types of things. And then we finalize this section with the OSHA reporting. Anybody who has an occupational illness, and we'll talk about that a little bit more, has to have an OSHA report done. So updating your communication plans to align with your faculty, staff, parents, and students. It's important to make sure you talk to those areas. You want to make sure the same unified message is going to your faculty, your staff, your parents, your students, and even the outside community. You need to determine what your methods of communication are going to be. A lot of things are done electronically now, and there's multiple ways. You can use social media, you can use emails, you can use posting on websites. But the one thing that we talk about in our prevention measures is using layers. Not any one single method of communication is going to reach everybody. So you need to make sure that you have multiple methods, and then the frequency has to be sufficient to be able to do the things that need to be done, and people need to know when they need to know. You have to be able to do updates as things change. Safety measures. You want to make sure that you document all the on-campus workplace safety measures and protections that you've put into place. You want to make sure that those safety measures are communicated to everyone. Everybody's anxiety levels go up with COVID-19, and especially as the incidence of cases rise. So it's important to make sure everyone knows what safety measures you have. It's also important to be able to document that you have communicated that to everyone in case there's an OSHA report or some type of other investigation or complaint. When was the last time everybody updated their contact information for the staff and faculty? We need to make sure that the staff and faculty have current information, including emails, cell phone numbers. and all the other methods to be able to communicate with them. We recommend each school has templates that are pre-made so that you know what you're going to do if you have a positive case in the school, whether it's a student or a visitor or a faculty or staff member. If you have a positive case that comes on campus, how are you going to notify people? You have to understand that you cannot give out certain information based on HIPAA. And so medical information is restricted, but you can tell people that there was a positive case. One of the mistakes that a lot of schools have made is they only send letters to those that are involved. And that would be your close contact notification. Those that are considered close contacts, as we've defined earlier, are going to be notified because they're going to be placed on medical quarantine. But if you don't notify the rest of the parents and the rest of the faculty and staff and the students that there was a case, then you can have a communication crisis. And so it's important to have templates for both of those matters.
And Scott, the fact that you don't know when a COVID case is going to pop up just highlights the fact that those templates should be prepped well before you need them, so that you're not scrambling last minute trying to figure out what to say and how to say it.
Absolutely. It's important for us to make sure that we're ready, because it's not a matter of if, it's a matter of when you're going to have a positive case come across your campus. So updating and validating job descriptions. Most of the job descriptions have taken a backseat. Some of them may be 10 years old because the teacher has been teaching history for 10 years and hasn't really done much of a job change. But there's a lot of differences now. We have to identify essential employee functions. What functions are required for that individual to be on campus? A lot of additional responsibilities have moved into the educational and academic world. Online learning, having curricula for both classroom learning and doing remote learning concurrently. So having the online learning curricula requirements, the online resources, the concurrent classrooms where they're being transmitted electronically and working with students that are remote, as well as students that are in the classroom. Some of our faculty and staff members are asked to clean and disinfect. That may change depending on the type of job description you have. A lot of job descriptions state and other duties as assigned, but you need to make sure that if there's any risk factors that are associated with these jobs, such as using a cleaning or disinfecting chemical, those things have to generally be in job descriptions. We also have a lot of work schedule changes, so it's important for us to make sure that all the duties and responsibilities for each respective employee, and this goes across the board for every employee that you have, both staff and your faculty.
So risk mitigation is absolutely key. There are a lot of pieces to the puzzle when it comes to doing a due diligence workers' comp claim or going through the safety measures. And so really it comes down to the plan and things that you have implemented so far. And this is why communication on those pieces is critical. So Fusion Cell has created the Big Six, and this is really against any viral respiratory pathogen that's out there. Things that you can consider as you're going through your planning process. So making sure that the HVAC system is bringing in fresh air and capable of filtering out anything that's in the area. Making sure that disinfection is happening and is happening routinely, that exclusion is happening so that only the healthiest folks are coming in. And that goes for faculty and staff, but also goes for students. So those three principles right there revolve kind of around making the building safe, and then making sure that the folks that are coming into the building are as healthy as possible. The other three are really around those behaviors that happen within the building. So keeping appropriate distance, wearing masks, and washing your hands as often as possible. So pre-programming hand hygiene in there. And they all come together, they all work together to make a great plan. And as you think about the different risks associated with it, you have to look at the risk of transmission, or the rate of transmission, the RT in this case. So the rate of transmission is really one person who is sick being able to infect another person. So if there's an RT of 2.5 with no mitigation efforts in place, that means that if Mike Klingshire comes into the building and he's sick, he can get 2.5 other people sick. So somewhere between 2 and 3 people will become ill because of me. So that risk goes down if you layer in masks. That risk further goes down if you keep distance, if you can screen and exclude people, if your ventilation system is up to par, if you are cleaning, if you're cohorting students, if you have staggered schedules, alternating drop-offs, all those other things that go into play, to include touchless hardware within restrooms and taking things offline, limiting lockers. And so this is a good representation. This is from the Massachusetts HTC, who did a study on what is the risk and how much does it get reduced as you layer in these different pieces of the puzzle. And so it turns it from Mike Klingshire can get 2 or 3 people sick to Mike Klingshire might get 1 person sick, but it takes 2 concurrently sick individuals, if you implement all this, to get 1 other person sick when you layer in all these different interventions.
So we talked about some of the changes to existing policies that you need to think about, and we wanted to focus on several of them right here today. Remote work, we'll go into a little bit more in the next slide, but remote work is very important because it's a new process that is not typically done with the K through 12 system. So we'll talk about that in the next slide a little bit more, but business travel, having local conferences, distance conferences restricted. A lot of places are putting restrictions on travel so that if you cannot attend electronically, then it's not worth exposing your staff to the risks of catching COVID from a conference. There's been a lot of outbreaks associated with large group gatherings. And so most of the business travel has been rescinded or reduced, but you need to have a policy for that, because the most important thing is to make sure that you are consistent with your policy. And that policy can't allow certain individuals to have disparate treatment, or certain individuals to be able to go to conferences and others not. So it's important in your business travel policy to make sure that you define essential travel. Conferences that need to be attended for continuing education and other resources are all available online now. So there's no need to put an additional risk factor for your campus by allowing employees to travel to conferences. That's why conferences like this one are excellent, because you have the opportunity to participate remotely. And then even in small group conferences are okay. But if you have large group conferences, it can cause major problems. Leave and time off policies need to be adjusted. Everybody has experienced layoffs, furloughs, and pay reduction issues that have come up. And then you have to have some type of plan for your school closures. What kind of compensation is going to be provided if the school is closed? Are you going to be paying the employees regular wages? Are they going to be using their personal time off? What type of situation are you going to have for that? Let's talk specifically about a clear remote work policy. Allowing remote work is not normally considered an accommodation, and that's a term that's been misused quite a bit as well. An accommodation, unless the employee files for a valid accommodation based on a serious health condition under FMLA or a disability under the Americans with Disabilities Act. So the schools need to have a clear remote work policy based on each school's respective business model. When the school is directed to go to remote learning, what happens at that point? What happens if you don't have some type of a job that can be done remotely? So those things need to be discussed in your policy. Employees' requests to work remotely are based on benefits to the business or to the school in this case. And so you need to weigh those factors. You also have employee requests for remote work as a reasonable accommodation for an employee for their own benefits that fall under the FMLA or the ADA. So you need to separate the reasons why you're allowing it. Currently, under the extended FMLA, under the FCRA requirements, you can take additional leave for childcare purposes. That's not a normal benefit. Normally, FMLA is based on serious health conditions only. So you have to weigh the options of what does it mean if your children are not attending school full time? Does that mean that you have the opportunity for that student to go some days? Does that mean that you're going to be at home and working remotely on Monday, Wednesday, and Friday because the kids are home Monday, Wednesday, and Friday, but they're attending on Tuesday and Thursday? And you really have to be specific about what it is that you're granting to the employees. The other thing that's not considered for most people is performance evaluations. Some people do really well when they're working at home with their kids. Some people not so much. Some people are really well versed in electronics and capable of doing remote learning from their home. Others maybe not. So it's really important to understand what the standards are, and that has to be in their job description as well, because performance evaluations are based on job descriptions. And you evaluate whether or not they're doing well, because even if they're eligible for it, it may become an undue hardship. An undue hardship is when it's not good for the business because of the fact that the business needs to take care of other things. So when you approve a work-related remote work policy, you need to understand those aspects. So let's go into some ADA definitions real quick. So a reasonable accommodation under the Americans with Disabilities Act is a change to the job application or hiring process, the way the job is done, or the work environment that allows a person with a disability who is qualified for the job to perform the essential functions of that job and enjoy equal employment opportunities. Accommodations are considered reasonable if they do not create an undue hardship for the business. So the definition for a disability falls into three categories: a physical or mental impairment that substantially limits one or more major life activities, a person who has a history or record of such an impairment, or a person who is perceived by others to have such an impairment. So that's the definition of a disability. Undue hardship is under the ADA when an accommodation would cause such a burden that it would amount to an undue hardship to provide, then an employer is not obligated to provide that particular accommodation. Determining undue hardship largely depends on fact-specific details that have to be evaluated on a case-by-case basis. So what would be a reasonable accommodation? If you are already teaching on campus and your students are on campus, you need your faculty members to be on campus. All of the requirements for their job description were originally made for on campus. So when you start talking about essential duties on campus, everything was an essential duty on campus at that point in time. For special circumstances like a pandemic and having the closure of the schools, there's modifications that are different. But if somebody's asking to work remotely and it negatively affects the school, what has to happen if a teacher is having students in the classroom and those students are actually also working remotely with some students and the teacher is remote? You have to cover the classroom. And so school-specific hardships for remote work include the nature and cost of your working remotely would require the school to hire additional employees to fill the essential campus duties and responsibilities for your job description. Somebody has to supervise those youth that are in your classrooms. So you have to have either another teacher take over, a co-worker take additional responsibilities, or you have to hire an additional staff member to monitor those classrooms, because you cannot have the kids in the classroom by themselves. It's not positive for the learning experience, and you do also have a responsibility for supervision of those students. The limited number of faculty and staff members that you currently employ generally cannot cover the additional burden of those additional duties from somebody else, and especially if you have multiple people working remotely. The type of operation and mission of your school is to offer exceptional on-campus educational services. That's the purpose of your schools. Remote learning is being provided only when necessary under special circumstances. So the negative impact of your remote working accommodations on the operations of your school is really significant. It reduces your ability to meet your current mission and to fulfill your current business model. So what you need to do is you need to understand that undue hardship is something that goes along with reasonable accommodation. We'll talk a little bit more here in a minute about the FMLA requirements and things like that. FMLA itself does not use undue hardship or reasonable accommodations specifically. We talked about the need for personal leave and personal time off practices to be updated. We have regular paid leave and PTO, regular sick leave, regular pay, leave without pay policies that most schools have already. You usually have an FMLA policy on who's eligible and what types of reasons for serious illnesses are allowed for those serious health conditions. But now we have FCRA, the Families First Corona Response Act. They allow up to 80 hours of sick leave that's paid through the system. And those reasons are very liberal, meaning that there's a lot of reasons why you can take that sick leave. You can take that sick leave if you were on isolation or being treated for COVID-19. If you were sent home on quarantine for it, you can use sick leave for that. You can use it for yourself. If you have a medical condition issue, you can use it for your family members. But it is limited specifically to the 80 hours. And then you have your expanded medical leave, which includes now adding FMLA to include the child care issues. You also need to implement a protocol for a positive COVID case at your school. We talked about having a sick employee and student protocol. Coordinating is so important with your local board of health. They have to do contact tracing, and with the assistance of your documentation as to what students are in which classrooms at which times and what seating they're sitting in, will allow a contact tracing process to go very quickly. Those individuals have to be placed on medical isolation that are sick. Those that are close contacts will have to be quarantined for the 14 days. This increased communication process is so important. We just recently had several schools across the US that have had increased cases, and they try and use only one type of media to communicate. Not everybody has Facebook. Not everybody has access to the internet. We still have a lot of individuals that have flip phones that don't have electronic texting capabilities and other things. So you have to look at your increased communication methods and make sure that you have all the methods covered so that you are communicating proactively and not reactively. You don't want the parents calling the school to find out what's going on. You want to be able to communicate very clearly what's going on out to the parents. And you can't forget the faculty and staff also have families. And so it's important to make sure that the faculty and staff have concerns and that those things are addressed with them. Then you also have the local community and making sure that if you have a media inquiry or anything, that you can address that properly. Required reporting is very important. You have to report any positive cases through the local board of health. They normally get notified through the laboratory testing methods. But one of the things that you have to remember is most of your schools have students that come from multiple jurisdictions and sometimes even across state boundaries. So the local Board of Health may not have access to that information as quickly as you do. So making sure your local Board of Health knows when you have a positive case. OSHA requires that you have very specific reporting. You have to have the OSHA reports done. And one of the things you have to do with the OSHA reporting is you have to determine whether or not it was workplace related. So it's a simple process to determine whether or not it was OSHA criteria based. What you do is you look at the situation. If you have a known exposure at work because of a positive contact investigation, meaning that you have a positive student in the class or a positive faculty member or a positive staff member that has exposed employees, if they catch COVID from that exposure, that would be considered a workplace exposure. And you would be required to report that occupational illness with OSHA on your OSHA 300 log. If you do not have that kind of evidence, the probability is that they may have contacted the individual that exposed them off campus. When the majority of their time is spent off campus, then the majority of the probability shifts to exposure off campus as well. The reason this is important is because you have to look at your reporting methods for workers' compensation based on the state that you're in. Your OSHA changes based on the state you're in. As an example, you have 3 states in your association, Vermont, Maine, and Connecticut, that have state-run OSHA programs. Vermont is the only one of the 3 that is run by the state, which covers private entities. Maine and Connecticut, they cover just the federal entities and the public entities. And then all the rest of them, Maine, Connecticut, New Hampshire, Massachusetts, and Rhode Island, all of you have to consider the fact that you fall under federal OSHA. And so the requirements are the same, regardless of whether it's a state-run program or a federal-run program, but the points of contact are different, and your employees can report complaints to OSHA, just like they can the EEOC or other Department of Labor organizations within your states. So tying everything specific to your state is important because you need to know and have those relationships build up now before you have an incident, especially with your Board of Health and your Department of Labor. OSHA is less likely to get involved unless there is a death or a serious illness with hospitalization. Then they have some increased reporting requirements. So if your investigation or your survey reveals that the probability was 51% or higher that they were exposed off campus, away from work, then you do not have to report it, but you still have to document it for OSHA purposes that you did the investigation and you determined that more than likely their exposure was non-workplace associated. So we have to document a lot of things, and it's very important for any type of investigation or complaint that is placed, whether it be OSHA, the EEOC, your Department of Labor at the state level or the federal level. Documenting employee training and their understanding of that training is very important. It can easily be done with class rosters or other methods, email transmissions with a read receipt. But the 2 areas you really need to focus on is you're having major changes to your policies and procedures. Some are temporary and some are permanent. So you need to make sure that there's documentation of the employees' training and understanding of those changes. Then COVID-19 specific policies and procedures are important for COVID specific incidences. Documenting that they understand the rules on wearing masks, that they understand the rules of social distancing, making sure that the policies are enforced universally across the board with all employees. All of these things need to be documented so that you don't run into problems later on. So, summarizing what we've talked about before we go into our question and answer session, we have the three phases we talked about. HR has always taken a backseat in most organizations. It's not exclusive to schools. Job descriptions are not always updated. HR policies are not updated as readily because we don't have prioritization or staffing to take care of those. Those aren't the fires that we're worried about burning right now. We worry about the other day-to-day activities. So it's very important for you to look forward to a process change, make that hazard assessment of your workplace safety, look at your communication plans, update all those job descriptions. You're going to have to do it now, as well as you're going to have to do it for the new year. You may, for a business decision, say that you're going to retain an employee, faculty member this year because you can't get a higher opportunity to hire a new teacher until next year. So you may let them, for a business decision, go ahead and work remotely. But when it comes to changes in the new school year, you're going to want to look at contracts that have the opportunity to maybe give them 2/3 pay if they're only working remotely and they're not fulfilling all of the duties and responsibilities. So you may want to create a job description that's specific for remote work only employees. You may want to have different job description for the employees that are doing both, and then a job description for those that are only teaching in the classroom. So you have to make sure that those contingencies are all involved in your updated job descriptions. And once again, you have to look at those COVID-6 items and make sure those are all documented so that you can have processes to show evidence if you get into any kind of complaints or disruptions in your business. Executing all of your protective measures and making sure that they're universally enforced. If you have a policy on masks, but you don't require the students to wear them, then that's a problem for your employees because the employees are being exposed and that becomes an employee issue. So all of these things relate to your human resources department policies. Your travel policy, you need to understand. COVID testing. You can, in fact, test employees for COVID. The EEOC has ruled that that is an essential function of their job to be disease-free during the pandemic. So you can test them initially before they come to work or periodically through routine testing. But those policies have to be developed and you have to have those consistently enforced. COVID testing is not cheap. It ranges from $25 to $55 a person. And so the frequency of your testing should be based on what you feel is necessary, with special groups being prioritized, such as if you have boarding students, they may have a higher testing rate or more frequently tested than others. But you need to have specific policies written as to why you're testing and when you're testing. Because the one thing you cannot do with parents and with employees is go backwards. So if you start offering a lot of testing, it's really hard to turn it off. And so those expenses can be up to $40,000 a round for some schools or more. And then you want to make sure that you have the capability to respond to positive cases. There's never enough time in a 24-hour day to get everything done. HR sometimes takes a backseat to other higher level priorities and immediate needs of your school. Fusion Cell is ready to assist as a COVID health and safety partner for your school. And we hope that we'll be able to give you a couple questions and answer session items. But before we do that, final thoughts. There is no such thing as a zero risk workplace for COVID-19. No one solution is perfect. Layers are the best chance for success. As you add each protective measure on top of it, as Mike stated, it reduces your risk significantly. Business decisions should drive HR policies. It's very easy to get emotionally involved with your decision-making process on who gets to work remotely because of their family concerns or their personal concerns. But consistency requires you to have a business decision-driven policy. HR policies and procedures need to be in writing. They need to be communicated well to your employees and applied consistently. Human nature leans towards complacency and fatigue. All of us are tired of COVID-19. All of us are looking forward to 2020 being over. But you need to remember that 2021 is going to continue processes related to this. Your family's first response programs and your extended FMLA end on December 31st. But Congress will most likely either continue those programs or extend them or create new ones. So do not plan on having those completely go away at the end of 2020. As COVID changes, the human resources playbook continues to change as well. In the military, we talk about semper gumby, always flexible. It's a term that's taken from the Marine Corps semper fidelis, always faithful. And we really have to be flexible in these times. There's no options for us to just move forward without having flexibility. As we learn more about the disease, the rules change. As we learn more about the prevention measures, the rules change. So you have to be able to change with those rules. So I'd like to turn the time back over to Becky and we'll do some questions and answers.
Scott and Mike, thank you so much. This is great information and I know our attendees will greatly appreciate it. The first question we have is, how do we separate what job duties are considered essential duties that need to be done on campus from duties that can be accomplished remotely?
I'll go ahead and take that one. That's a great question. The general mission of your school is to do on-campus education. So the traditional on-campus face-to-face learning model is your essential business. This can include remote instructions, but remote instructions are part of the process of adding on to increase your capabilities or to adjust. So you should think of all your duties and responsibilities on campus as being essential. The exceptions can be made for remote work for those on a case-by-case basis. And this would always include a closure notice from the state or the Commonwealth if they close you down. So it's important to remember that your purpose and your business model is to be on campus. So all of those duties and responsibilities were originally written for campus work.
Thanks so much for that, Scott. The next question that we have is, what can employees do to reduce their personal risks for COVID at work?
That's a good one, and I'll take it because it's right in my wheelhouse from the public health sense. So we talked a lot about the big six, and the big six being keep your distance, wear masks, and wash your hands. Really, those are three behavioral things that people can do to help reduce risk while they're in the work environment. And there's also another piece to that. And so it's really keeping your coworkers, keeping your staff, your students, holding them accountable to make sure that they're wearing their masks properly, that they're sanitizing their hands correctly, and that 6 feet means 6 feet, and it's not, well, we're mostly 6 feet, because your risk increases as you decrease the distance and as mask compliance falters.
Definitely, and I think that is such a hard thing to keep reminding ourselves of, but so important. So thanks for mentioning it. The next question we have is, we have had some faculty members that have never returned to campus and continue to teach remotely at some of our member schools. How do we get them to return to campus, and is that the goal?
So that's a very good question, because we've run into that with several of our partner schools. Any permissions or authorizations can always be withdrawn. The reason why they were given the remote opportunity to start with is generally related to FCRA. So that ends officially on December 31st. So just initially providing them with notice that their opportunity for their accommodation is ending December 31st. Then with that notification, you let them know that they are expected to return to campus to their normal duties and responsibilities. Include a list of all the safety measures that you've provided and the upgrades on campus. And then give them the opportunity to apply for whatever they're eligible for if they need to continue. So they have to make a career choice as to whether or not they feel like they're going to be able to continue being a teacher in a K through 12 system, because some of them don't want to come back unless there's a viable vaccine or fear. That is not a reason to allow somebody to continue to work remotely. You do have people that do fall under the FMLA category of a serious health condition, and so they can apply for FMLA. You do have people that have enough leave built up in their system that they could take a paid leave of absence, which would allow you to hire somebody else. Once again, we talked about the possibility that you may, for a business decision, not be able to replace that employee. So the most important thing is, if you continue to let them stay remote, is that you change it over from an accommodation to a business decision. And that way the liability goes towards the business decision, and you're not going to be called upon with a complaint saying that you're being disparate treatment based on one person being able to have the time off and another person being able to be required to come back to campus. So, however, a need to work as a reasonable accommodation under the Americans with Disability Act, employers are not obligated to allow telework.
And can an employee be paid for an eligible personal reason and then again for taking care of eligible family members?
That's another thing that's come up quite a bit. There are limitations. So under FCRA, they have the 80 hours of sick leave. If they use 20 hours of sick leave for themselves, they still have 60 hours of sick leave left. So that gives them the opportunity to use the maximum of the 80 hours of sick leave. The same thing with the extended FMLA. They can use the 80 hours for their sick leave, which is paid, and then they can go on up to 12 weeks total, so 10 more weeks of additional paid leave under the extended FMLA program. But they can't go beyond that. And that's the other factor to consider, is depending on which program they apply for determines how long their eligibility is there to be on remote or to have time off that's paid.
Thanks, Scott. One of the questions that came up is with regard to contact tracing, and just how do schools determine where a COVID positive employee contracted the disease? The employee claims it was at work, but it could have also been out in town somewhere.
So we talked about this briefly in the presentation portion, but this is a different scenario. This is an employee who is actually claiming to have workplace exposure, and they're essentially applying for workers' comp or some kind of compensation for their illness and or their long-term illness responsibilities from work. So this is an even more important investigation or survey that you need to do. And you need to show that the probability is that it was work-related or the probability is not. OSHA does not expect a organization as a small school to do an in-depth investigation. It's basically a due diligence investigation. You're doing your best and you have to determine that. And then the documentation process that you've had with that, as well as all your protective measures, positive case lists, and contact investigations for tracing will allow you to give a higher probability of accuracy to your statement as to whether or not they have it. But it's very important, if an employee actually claims that they were exposed at work and they caught it from work, to make that determination quickly.
Great, thank you. And can an employee use expanded FMLA type benefits intermittently in combination with working remotely at the same time if their kids are going to school part-time and doing classes remotely part-time?
So intermittent work is something that has to be approved by the organization. So your school would have to approve that. But it's beneficial for the school in a situation where the student, their child is only going so many days a week. You can give them the compensation for the days they can't work, and then the other days they can come to work. So it is authorized under the FMLA program, and the only thing different with extended FMLA is not only can you use it for serious health conditions, but you can use it for childcare issues. So that's the difference. Once the extended FMLA expires, if it's not renewed, then they will not be eligible for that benefit for childcare anymore. But as we expect, there'll be some type of benefit, but it'll still be limited to the original number of weeks of 12 weeks total. So they can use it intermittently, but it's a total of the number of days. So 12 weeks times 5 is 60. So they can't have more than 60 total days in a 12-month calendar period.
And this is where I think your Semper Gumby comes in handy, because there really is a need for flexibility with all of this.
Well, one of the things we really want to remember is the humans in human resources are your employees. You know, they all have individual lives. They all have things that are going on in their lives, and we want to retain our best employees. So whatever we can do to be flexible is always beneficial. And the school can give additional opportunities for them to use their regular leave for these type of situations as well. So even if they run out of paid leave from the special circumstances, they could use their regular paid leave intermittently to be able to do the same thing.
And it looks like we have a couple minutes just for one or two more questions maybe. And I think this one probably will go to you, Mike. How do we know if a sanitizing chemical is effective in killing COVID-19?
It's a great question. I'm glad you asked. So every disinfectant that's out there on the back label somewhere has an EPA registration number. And the EPA has posted on their website under their List N, List November. So List N has all of the chemicals and disinfectants that are effective against COVID-19. And you can use their search tool with the EPA registration number to figure out quickly and effectively if what you're using is effective against COVID. And so additionally to that, there's also descriptors in there. So the list will tell you what the active ingredient is. The list will tell you what amount of time you have to leave it wet on the surface to achieve the manufacturer's disinfection. And then it will also tell you items such as the surface requires post-rinse, depending on what it is, if it's a food contact surface, or it's only for use on hard, non-porous surfaces.
Great, thanks so much. Another question we have is, how and when do schools apply for the tax credit for employees that took FFRCA COVID leave?
So that's an important question because it's really difficult to comprehend that the government's going to give you as much money back as you ask for. So it's important for you to make sure that you document everything. As long as they were eligible under the federal guidance, then you can get a dollar for dollar value back from payroll taxes. So it is something that you'd have to work through your accounting department with your taxes with. But what they're going to do is give you a dollar for dollar tax credit towards your payroll taxes. And so that's the way that you get reimbursed. The one thing that you do have to remember is you're going to have to document the eligibility of that person and the reasons why they took the leave.
So some of this feels like a foreign language to me, which is why it's so great to have industry experts like you helping us with all of this. But we are just looking at a few of the questions that came in, and we see FFCRA and FFRCA. Is one of those a typo, or are they two different things?
So you have your FCRA, which is the Families First Coronavirus Act, and that is the primary. So the other may be a typo, but underneath FCRA, there is the Emergency Leave Act and the extended FMLA Act as well.
Thanks so much for clarifying that. With regard to the FCRA, sixth reason for taking COVID leave is vague. What does it mean to have a substantially similar condition?
This is another excellent question because this is a caveat that was put in there in case it was needed. So both Health and Human Services and the other departments of Department of Labor and others have to agree on what that means. So you cannot have an employee just say, well, I've got something similar, so I'm eligible for reimbursement. So it has to be something that's actually declared by the Health and Human Services. And to this point, nothing has been. So that caveat for item number 6 is not eligible for use at this point in time.
And I know we've touched on some aspects of this final question, but this is a scary and unsettling time for so many, and learning how to navigate each individual in a unique and individual way is something that all of our schools are working on. And would an employee who is afraid of coming to work and contracting COVID-19 be eligible for paid sick leave? And I know you hit on that, but it's also a specific question, and I just wanted to make sure we went back to it.
So the general answer is no, not under the current FFCRA. And really it's because it's a concern and it's not related to anything that's documented. And the concern is really, I don't want to be exposed. But as Scott mentioned, there's so much of a human's life that's outside of the school that it's almost unreasonable to say I can't work because I don't want to be exposed, but I still have to go to the grocery store to pick up my kids. And so really the sticking points are those 6 reasons under FFCRA that you're held accountable to. Now, there are additional things as Scott mentioned. So FMLA and extended leave, there's different policies where you can take time off, but it doesn't specifically fall under FFCRA for a concern.
And I can only imagine that we'll have more questions coming our way with all of this information that you've provided. So we'll look forward to our next opportunity to partner with you and the rest of the team at Fusion Cell. But just wanted to thank you so much for today and let you know that we look forward to our next time together. And we'll definitely look forward to sharing this information out with our membership.